The upcoming launch of a consultation for England's men's health strategy comes at a crucial time, but its very necessity speaks volumes about the current state of men's health, which continues to be largely ignored and underfunded. The disparity between men and women's health outcomes is stark, and the underlying reasons for this inequality are complex, ranging from biological factors to societal pressures that discourage men from seeking help or even acknowledging their own health struggles. It is not just a matter of lifestyle choices. It's about deeply ingrained cultural and systemic issues that leave men vulnerable and overlooked. In the UK, men have a significantly lower life expectancy than women, by 4 years, and are nearly 60% more likely to die prematurely, with heart disease, lung cancer, liver disease, and accidents among the leading causes of death. While lifestyle choices like smoking, excessive drinking, and poor diet certainly play a role, it would be naive to dismiss the broader social context that exacerbates these health challenges. Men are not only more likely to engage in risk-taking behaviors, but they are also less likely to seek help when problems arise. For instance, a young man in Bradford climbing a drainpipe to ask for condoms encapsulates the discomfort many men feel when accessing health services. The reluctance to seek help is compounded by a lack of health literacy and the deeply entrenched notion that men should man up and deal with things on their own. Professors like Alan White have pointed out that men's health is often simplified to poor lifestyle choices, but this narrative fails to address the nuanced realities. Men are less health literate, meaning they don't develop the skills to understand, talk about, or act on health concerns. The societal expectation for men to be tough, resilient, and self-reliant does not accommodate the reality of health struggles. This expectation is not just limiting but actively harmful. It means that men, especially those in blue-collar jobs or marginalized communities, are not seeking the care they need and are likely to suffer in silence, leading to preventable deaths. For example, men working in construction or other physically demanding jobs often feel that they cannot afford to take time off to attend health checks or see a doctor. This is exacerbated by the financial pressures and job insecurity many face, contributing to the disturbing trend of high suicide rates among men, which are nearly 3 times higher than women's. Despite this, men are underrepresented in mental health services, with only a third of those sent for talking therapies being male. The reason for this disparity is not just cultural, but institutional. Men's mental health symptoms often manifest differently through anger, substance abuse, or withdrawal, rather than in ways that traditional services are equipped to address. Moreover, the system of health checks designed to catch early signs of diseases like heart disease and diabetes is failing men. NHS health checks, crucial in detecting early health problems, are underused by men, with fewer than 4 in 10 taking up the offer. This is partly due to the structural barriers in place, with many men working in industries that make taking time off for health checks impractical or even impossible. And even when they do attend, the environment may not feel welcoming, with a lack of awareness of how men express their health concerns. Health disparities also extend to ethnic minorities, with certain groups, such as Black men, at a much higher risk for conditions like prostate cancer, and men from South Asian backgrounds disproportionately affected by diabetes. These racial and ethnic health inequalities compound the already challenging landscape of men's health, highlighting the need for targeted interventions that consider both the cultural and economic factors influencing health outcomes. While there is some hope that the new men's health strategy will address these issues, the reality is that it may not go far enough. The government's approach to men's health must go beyond simply creating a strategy. It needs to reshape how health services are designed and delivered, making them more accessible and relevant to men's specific needs. The traditional one-size-fits-all approach is clearly not working, especially for men in lower-income or blue-collar jobs who face a unique set of barriers to accessing care. What's needed is a complete overhaul of how we think about men's health, from a focus on prevention rather than just treatment to making health services more male-friendly. This could include more outreach in workplaces, particularly in industries like construction and manufacturing, where health problems are often ignored or hidden. Offering paid time off for health checks, making health screenings available at places of employment, and developing programs that speak directly to men's experiences and challenges would go a long way in addressing these disparities. The reality of men's health is bleak, but there is hope if meaningful action is taken. It's clear that men's health needs to be a priority, but this cannot happen if we continue to ignore the complexity of the issue. A shift in how we view men's health, not just as a personal responsibility but as a societal issue, is crucial. It is time for men to stop being invisible in health conversations and for health systems to stop failing them. The men's health strategy is a start, but it must be just the beginning of a more profound and lasting change.